What's going on, everyone? I'm Data Report. I do daily pandemic updates right here on this channel. We did one earlier today. No, this is not a second pandemic update for today. This is more of a reality check of where we stand right now here with the ongoing COVID pandemic that we were led to think or believe ended. It did not end whatsoever. Earlier today, when I was doing that pandemic update, I read a piece from Mike Horger's weekly forecast. I'm going to read that piece to you once again. I'm going to read this paragraph to you. When considering the forecast, view it two ways. One, based on current trends and historic data. This is what we would expect too. If human behavior defied historic trends, we could see something much different, such as a wave subsiding if everyone were more cautious than average this year, or unfortunately something slightly worse than predicted due to the decline in public health guidance on mitigation. Decline in public health guidance on mitigation. To be honest with you, we have not seen a clear directive from public health agencies. We hardly hear about COVID from the president anymore. We hardly hear about COVID from the CDC. We hear them talk about other viruses more than COVID. COVID did not go away. And I got news for you. There's a lot of things that is not happening this summer. Let me explain. First off, take a look at this. Let's go all the way back to December 28th of 2022. President Biden said the following. We have the tools to make sure COVID doesn't leave its mark on 2023 like it did in years past. Use them. Protect yourself. Protect those around you. COVID.gov. Okay. We'll use those tools. Well, let's talk about those tools. Remember these things right here? Yes, COVID test kits. If you haven't seen one of them in a while, yep, this is what they look like. They come in several different boxes and packaging. Well, back in the winter months, even in the winter months of 2023 going into 2024, we're jumping ahead here. This was 2022. The government did send out another round of test kits. Well, we're in a major summer surge right now. Cases are up. Hospitalizations are up. Deaths are rising once again. They're not sending out COVID testing kits. Yes, you're not hearing about them all that much right now. Why? Well, this is coming from Joe Friday on Twitter. X now, we call it. Back in 2022, it was still Twitter. He's done 2 tweets on this. He put, important upgrade regarding the tools. Limited stock. Well, not much has changed in 2024. And take a look here. You can see rusted old tools. Let's be honest, folks. Our COVID tools, they look like that. The vaccines. There's new vaccines updated for boosters that are going to be coming here in the near future. We haven't heard anything about that in a while. There has been nothing said on the update on the boosters. Nasal vaccines. We keep hearing promising studies and reports that they may possibly be coming, but nothing comes of that. So this is a real problem. We're basically giving COVID the upper hand at spreading and mutating into new variants. Let's continue on. CVS, this is brand new, reported. This article was put out today by the Business Times. COVID surge limits CVS at-home test supply in some cities. Some CVS Health pharmacies are selling out of at-home COVID tests as a summer surge in infections drives up demand. And I can tell you this much. One of the apps I do, we deliver for CVS. Yes, I deliver things. And I was in line at CVS the other day to pick up a retail checkout order. Person in front of me was ordering COVID tests. And I happened to note behind them at that CVS, there were hardly any COVID tests left. I'm also starting to see again, on the cold and flu aisle, limited stock. Again, we have the tools. A limited stock supply of cold and flu medicines. Hello, folks. It's summertime. I could understand if it was fall or winter. Fine. No, it is summer. It's August 3rd. This should not be happening in the summertime. Okay? President Biden, we talked about him a little bit ago. This summer surge has gotten him too. He had a case of COVID. Yes, he sounds fine and better now, but let's face it. He had a case of COVID. This is hitting people hard. Summer Olympics, it's hitting there. There's been several other political figures who have had COVID recently. John Fetterman, he's a senator for here in Pennsylvania. He has had COVID recently. But, hey, let's continue on. I mean, we're not taking this serious for some reason. I mean, we have the tools. Well, do we really have the tools? Remember, what I showed you from President Biden was back in 2022, the end of 2022. He said, let's not let COVID leave its mark on 2023. Well, I got a news for you. It left its mark on 2023. It's still leaving its mark here on 2024. And speaking of having the tools, we also do not have the data. Only 33.9% of hospitals in the U.S. submitted COVID-19 data in the past week, over a week ago, reporting by BNO News. But let's continue on. This is the third week in a row. They'll have a new update tomorrow. The previous one said it was the third week in a row with 500 new deaths in the U.S., so deaths are starting to go up again, or 1,631 in the same period. It's also the 228th week in a row with more than 400 new COVID deaths, or nearly 1.2 million deaths combined. 228 weeks, over 400. So yeah, COVID continued to leave its mark, but yet we did nothing about it. You know, someone's losing their grandmother. Someone's losing their parents. I mean, think of it. You have someone who had a mother and father. They were growing up. Let's just say there were two kids. The father contracted COVID. The father was hospitalized from COVID. Now the father died. The mother now has to raise those two kids by herself on one income because the father died. Why? Because, well, we're not even bothering to test for COVID anymore. We're not sending out the testing kits. No one's bothering to wear a mask anymore. No one's bothering to do anything. Then you have the other factor, long COVID. That's a big problem as well. People are getting COVID, they're starting off mild, and then they're developing new problems down the line, and suddenly they're getting too sick to work. Guess what happens with that? If you're too sick to work, you can't bring in a paycheck. That is a serious problem as well. But let's continue on. COVID positivity rate. I told you we're in a summer surge. COVID positivity rate reaches second highest ever recorded. This is out on the West Coast. I believe this is in San Diego. But it's happening in many different places. Let's continue on. Italy? They're having a similar problem. Look at the COVID levels in Italy. Look at this chart. They just continue to go up and up and up and up. And meanwhile, they're saying, oh, it's mild. It's fine now. No. As we know, mild is often the time or type of case that leads to long COVID. Oftentimes, as I just said previously, long COVID starts from a mild case. But let's continue on. South Korea, hospitalizations, cases surge fivefold in 3 weeks. Hospitalizations surging. But I thought it was mild now. Well, no. People are still being hospitalized. You saw the deaths are still occurring. Here's another problem. Sometimes when you go to a hospital, you're told to put on a mask, otherwise called COVID mask. Let's just do a Google search for COVID mask. Well, here's what comes up. You do see some N95s. You see a heck of a lot of surgical masks. In the early days of the pandemic, before Omicron came along, many people did not know any better to wear a N95 mask. A lot of people knew, oh, well, they're saying to mask up. Cloth mask, loose face covering, surgical mask. A lot of people did. Well, I got news for you. Here in 2024, not only do people not know to wear a proper N95 or how to wear an N95, I'm going to show you how to wear one in just a second. Not only do they not know how to wear an N95, they simply don't wear a mask at all. And we do know, study shows, take a look at this, on average, wearing an N95 respirator reduced the viral particles exhaled into the air by a whopping 98% compared to the other cloth masks and those surgical masks. I'm telling you, wearing the correct type of mask does work. Saying, oh, well, COVID masks don't work. That's because in the early days of the pandemic, when masks were mandated in major cities, hospital settings, and a whole bunch of other places, even states, they're full states. Some states did not go ahead with it. Some states ended it within a couple weeks. You were wearing the wrong type of mask. Those cloth and surgical masks don't work. This is an N95 mask. I'm going to show you how to wear an N95 mask. Forgive me, the sound may get a little messed up here. The first thing you do, you take this loop, you put it over like this, then you put it around your back ear. You make sure you get a tight fitting around your nose, down below and take a look here. Do I sound muffled? No. You can still probably hear me just fine. Yes, you heard some noise when I was putting on the mask. I had to take my headset off. Forgive me for that. Look at this. It's not any harder for me to breathe. I'm someone who suffers with asthma. My O2 levels do sometimes drop when my asthma's bad, but they do not drop when I'm wearing a mask. In fact, I am going to show you my O2 level right now. Check this out. I grabbed my O2 meter. Look at the reading. Yes, 97, 98. Do you see my blood oxygen level dropping? No, you do not see it dropping. Wearing a mask is safe, and it is effective to do. It is effective to wear a mask. It prevents the spread of COVID when you're out in the public. No, you do not need to wear a mask in your home. I'm showing you an example right now. I just showed you how to put on a mask. If you're going to the grocery store, if you're going to the drugstore, maybe you're going to Walmart. A lot of people like to shop at Walmart. All walks of life walk in Walmart. Guess what? COVID lives there. COVID lives at the grocery store. COVID lives even in your local neighborhood restaurant, a whole bunch of different places. Maybe you're going to a large gathering. Going to be a lot of people. COVID lives there as well. You know what else happens in these poor ventilated large gatherings? The level of your air quality goes up as well. Now we're getting 798, which is not a terrible reading. It could be better. If my air purifier was on, if the air conditioning was running right now, it would be better. Oh yes, air purifiers. Ventilation is key to preventing COVID cases as well. That's another tool. This is a tool. AirNet, it's not a requirement for you to have one. They can get rather pricey. Sometimes they do run a sale on them. It's not an ad for AirNets, but if we used all these different tools, testing, masking, proper ventilation, guess what? We actually would cut down the COVID cases. We actually would make things somewhat safe again. But because we fail to use any of these tools, because we fail to replenish the tools, because we fail to give any messaging as to what's going on with COVID right now, or any messaging to, hey, a mild case can lead to long COVID, here we are stuck in this hamster wheel that goes round and round and round and round we go. Where it stops, nobody knows. Kind of like a merry-go-round as well. You know how it just keeps spinning in circles, and every time you're going around, you're seeing the same things over and over again. That's COVID. We had a summer wave at the start of COVID. We've had a summer wave every year of COVID. We've had a winter wave every year of COVID. Sometimes we've had extra waves. And here we are. We're in the middle of another summer wave. It's going to peak relatively soon. Then it's going to drop some. Not back to spring levels. It's going to drop some. Then it's going to go up again in the wintertime. And we'll have even more new variants. Why? Because we're allowing the virus to gain the upper hand on us. The virus is essentially strangling us. It's got us by the tail. It's saying, ha ha, ha ha. I win. I keep spreading. I keep mutating, and you do nothing to stop. Yeah, because we're allowing it to do whatever the heck it wants to do. Not trying to be funny there, but get what I'm saying? The point is, we need to continue to take this serious. We need to communicate to the public better. I mean, I'm just a very small source. I don't see any national outlets going on stating how bad things are right now. And any national source stating, hey, CVS is out of COVID test kits in the middle of a major summer surge. That is a real issue. Yeah, it is. Maybe you ought to report on it and then ask the CDC or White House, why aren't you supplying any more test kits? What's going on here? COVID did not end. Get my point? I hope I taught you something today. If you didn't know that we're still in a major surge, or if you still think this is not a big deal to you and that it's over with, you may want to think twice. I'm sure at this point everybody knows someone who was impacted by COVID and is still potentially being impacted to this day. COVID did not end in 2021, 2022, 2023, or here in 2024. Unlike what President Biden said back in December 28th of 2022, COVID is still leaving its mark here on the planet Earth and right here in the United States and all around the world. If you enjoyed this video, give it a thumbs up, subscribe down below, hit that subscribe button, share this video, notification bell, leave your comments down below. Thanks for watching, and remember to mask up when you go out to them crowded public settings, because COVID is still out there. I'll see you all again next time.